Welcome to Health Impact Live for another digital health talk. I'm thrilled to be here today with Wesley Barker, Branch Chief and Data Scientist with ONC, and Dr. Ben Rosner, Associate Professor at UCSF, founding CMIO at HealthLoop, and of course, Scientific Chair for Node Health, which is how, of course, I know Ben. Thank you both for being here. I'm excited.
Nice to be with you.
So the reason... Great. And the reason I reached out to Ben after seeing his article on LinkedIn called "What Are the Experiences of Digital Health Companies Integrating Their Tools with EHR?" which of course is a topic of keen interest to myself as well as our audience. And we've covered it in many ways. We've had Dr. Tripathi on for talking about TEPTA and a lot of work in terms of how this is going. And, the article, which was the LinkedIn article, which was referencing the research published in the January issue of the Journal of American Medical Informatics Association, was both, very accessible, which I enjoyed because it really kind of painted a clear picture, but I think also really interesting in terms of the findings. So Ben, why don't you start and tell us a little bit about, kind of the why of this and what the goals were?
Sure. Thanks, Megan, for having us. I will say that this could become like a very technical conversation, but it's rooted in something very practical and I think very meaningful, both for patients, for clinicians, anybody who has interests in healthcare and how sort of the digital world is affecting healthcare. So, years ago, when electronic health records, we're going to call those EHRs, first got used, and then the emergence of digital health came about, we were living sort of in a world of a digital Tower Babel, meaning that there weren't really any standards for how maybe a health app developer might have their information integrate with the electronic health record or communicate. And this made it really hard for developers and also for health systems to integrate these emerging digital health apps with their electronic health records. And so to try to reduce the noise in that era of Tower Babel, in the 21st Century's Cure Act of 2020, some standards were put into place to try to normalize the how of the communication, how the communication should be done, and that the implementation deadline for that was in 2022, and so we were curious to what degree did the 21st Century's Cure Act kind of move the needle for digital health app developers and electronic health record vendors, so that they started to revolve around a single standardized way for how they would communicate with each other. And so this study was really to understand, how are we doing with respect to that? What are the barriers and opportunities for the future?
That's great. Yeah, no, it's really, so much work has gone into it. And so what has been the, impact and effect? Wesley, tell us a little bit about, kind of what you looked at, how you got the group together, to do that research.
Yeah, so, I think a little bit of background. So the California Healthcare Foundation, they actually funded a couple initial surveys in 2016 and 2018. Working with folks at the healthcare blog to kind of look at this topic initially, kind of even I think before the Cures Act was actually passed by the U.S. Congress, and because it was a very emerging topic, people were very interested in the state of app developers and other digital health companies connecting to EHRs and their success with that. And so they had conducted pretty good surveys in 2016, 2018. So us at ONC approached them probably in 2020 or so to kind of figure out, were they going to continue that work? Was that something that they were going to continue beyond 2018? They were definitely interested. So we partnered with them to kind of think through, what would this next survey look like? What would be the focus? And so eventually the California Healthcare Foundation made a grant to University of California, San Francisco, with Ben as one of the team members, also included Dr. Julietta Milstein, Natalia Mazel, as well as Grace Kruger, who are also part of the project team there at UCSF, who kind of like dived into, the topic, created the survey instrument that we use to survey digital health companies across the United States, to ask them, there are a lot of questions, and as you can tell from the paper itself, we really focused in on those companies' experiences, specifically working with EHR companies and their specific experiences using the application programming interfaces, or APIs, that those EHR vendors provide for those type of connections for app developers and digital health companies to kind of connect and move data between their system and their app.
Was there a specific type of company you were looking for with respect to the participants? I mean, there's such a vast variety.
That's a great question. So the sample that we used was based off of other research that I had done prior, that kind of looked at all of the companies, digital health companies that we knew were already connecting to EHRs. So there's a lot of different like EHR app galleries and marketplaces. Epic has had one. Historically, it was called the App Orchard, but it's since changed its name, as one example, where there was evidence of companies working with those EHR companies. And so in a wide variety of applications and use cases, both for patient access to the health information, lots of clinical tools for clinical decision support, and patient engagement, health information exchange. So lots of use cases. I mean, I think we were mostly focused on digital health companies who are providing sort of an app or service that have like a human interaction element. So sometimes there's a lot of like system-based apps that just enable like computer-to-computer communication. So we're most interested in an application or service that enabled either a patient or a provider some sort of functionality to interact with the EHR, interact with the data itself. And so pretty decent list, over 700 companies were included in our study. About 141 or so responded in full to the survey. So pretty decent size respondent group across, and as we detail in the paper, across different types of application use cases, both clinician and patient focused use cases.
Right. Yeah, that is a great response rate. In terms of the results, I know just in reading it that it was about 73% are using the standard APIs, which to me seems high. That might be because I have teenage boys and I'm kind of used to a C average around here. But in terms of, was that high? Did you feel it was high enough?
Yeah, I mean, I think it was hard to know what the rate would be, because based off like our prior studies, like we knew a lot about who was connecting, sort of like the purpose for connecting, but less about how they were connecting. And one of the things that we really kind of focus on and ask about specifically in the study is, do you connect using standards-based APIs? And those standards-based APIs include the HL7 Fast Healthcare Interoperability Resources Standard, also called FHIR, FHAR, as well as a standard that that ONC supports called the United States Coordinator for Interoperability, or USCDI. And that enables both, FHIR is sort of a standard for as a method of exchange, so that it transports standards, so getting information from one computer to another. And then the USCDI is sort of a standard of data elements. So the expected data that would be included in the record that's exchanged between systems. And so we are, asked specifically about, those types of APIs. And then we also asked more loosely about just general proprietary EHR APIs. And the proprietary APIs are sort of APIs that a specific EHR vendor like Epic or Oracle would create to facilitate any type of like exchange between their EHR and another system. And so those, for those proprietary EHRs are very common and have a lot of use cases. And so we wanted to ask about both, and what, we're very interested to see what the difference was in the level of use for those types of APIs and how that relates to, the different digital health companies, like support for those standards and the use cases for their applications. So is 73% high? Yes, I think it is. I mean, I think that's a great baseline. We could have expected any sort of number, but yeah, I think 3 out of 4 companies saying, yeah, we connect using standards-based APIs this early on, that's a success.
Right.
Oh, Megan, I want to say, here's what's kind of interesting about that 73% though. So 16% of companies use only standards-based APIs. And it's 57% who use sort of a combination of standards plus proprietary. So in the ideal world, you'd like everybody to go to the standards-based only. We see 16% currently, but we know that overall 73% of companies do have experience with the standards-based APIs. So, I think there's still room to move the needle to drive more maybe to that only category. And I guess the reason that I sort of feel that is like the proprietary ones. So I'm gonna use another analogy here. The proprietary ones are sort of like a language that you need to learn, but maybe you don't know yet. So like imagine I show up as an observer at the United Nations, and there's all these different people speaking all these different languages, and I don't know who I'm going to be interacting with or plan to interact with. And so if I knew that everybody was using a standard way of communicating at the UN, so maybe it's that earpiece and there's a live translator, then that's all that I have to bring to the party. But if there are some people coming to the UN that I might interact with and they say, nope, we are only using Google Translate, then I've got to make sure to bring some tool that I can use to Google Translate with them. Or if there's other people showing up at the party that are saying, we are only going to be doing this via text, or we're only going to be doing this pen and paper, I've got to bring all those supplies and know how to exchange information in all of these different ways. And so, in my ideal world, I go to the UN and I only need to bring one tool with me to know that I can exchange information. And so by analogy, the more we see uptake of the standards-based APIs, the easier it becomes for digital health vendors and EHR vendors to communicate with each other in a standardized way.
Right, which makes sense, and certainly is kind of the goal of bringing making the standards APIs available, right? In terms of the barriers, right? Tell us a little bit about what are the barriers for folks who are choosing to use the proprietary over the standards.
So we have like a list of like sort of top 10 substantial barriers in one of our figures. And, the one that really is at the top is high fees. That's been, that was expected to be the most substantial barrier. And that was, shown to be the case in our study. And, I think that's something that, ONC, HHS have like addressed in the sense of like in the CURES Act regulations that ONC passed, and looking, and kind of articulating that, fees are going to happen. Like you can't do things for free. These services that EHR developers provide, aren't a free service. There's a lot of, costs involved. So fees are to be expected. But so it's kind of hard to regulate.
Just to clarify, and maybe, this is just my own naivety around this, but the fees are coming from where? Are they from the EHR companies for using them, or from the proprietary companies, or from the standards organizations, or all of the above?
So the fees, it could be a different number of things. I mean, it would be, in this case, it would be the digital health companies paying a fee to an EHR, so like Epic or Oracle, to use their API service, or to use their, app connection service, however they call it. And, that can, that fee can, be, for a different number of reasons. I mean, I think for the EHR vendors, often it's described as like this is the cost of use of our APIs and the cost of use of us providing the development support to access our systems. So, there's not always, I would say, like a lot of transparency in terms of what makes up all the costs that go into those fees. I mean, I think to your point, like it could be a lot of things that the EHR companies sort of like, kind of like lump in there. It could be, the cost of them to help support the standards, cost of them to help support, continued development and support for the different APIs that they provide. And yeah, that's not, a low cost thing. But it can vary. I mean, if you have, if you're a large company like Epic and you have maybe like thousands, tens of thousands of potential like API users, you can imagine that like, the scale of that fee could go down based off of the number of users you have. Obviously, it doesn't always happen that way, but
right. But it does apply. So the fees apply both to proprietary and standard based. It's a barrier on both sides.
It's sometimes it can be a fee of just like, it's going to cost you 10 grand just to like access, these production APIs. So it could be just a lump like access cost or access fee. It could also be like, I think what's also pretty common is if an application is in production with an EHR's users. So let's say you have an application, it's in production with UCSF, and for every 100,000 API queries, there's a cost. And so it is also a fee associated perhaps with the amount of usership and use of your application at a particular client side as well.
Part, Megan, that the reason those fees sort of came out as one of the larger barriers is that the digital health industry is skewed towards younger, smaller companies, the startups. Even our sample was, we also had big companies too, but even our sample was skewed towards the smaller startups. And so those companies, they don't have a lot of operating cash. So that kind of fee might be negligible for a big company, but it could be a big deal for a startup.
Sure.
There were some other barriers too that they describe, which is, once a company pays the fees and they then can access the testing environment, they want to have realistic data and data elements in that testing environment and data elements that are of interest. And so we saw also a lot of our respondents saying that not all the data or data elements were kind of relevance to their needs.
Yeah, and that's another, I was wondering about that in terms of like, what, can you give an example of what those data elements are and like, what are the ones that are of little interest and what would be of more interest? Or is that maybe, that's fodder for the next study?
I mean, we did see like for future opportunities, there is a lot of growing interest in greater like genomic and genetic type of data elements. I mean, that's where I think there's future potential and maybe it's a little bit underserved currently. I think that's probably a big one. Wes, the other ones that you'd suggest?
Yeah, I mean, I think, it's one of those things where, so like going back, we were talking about the US CDI, and US CDI itself has different versions, different data elements are incorporated into each of those versions, and that expands over time. So the ONC actually has a predictable process where we update that standard every year and accept public input into like what data elements can go into it. And then, we ultimately finalize that standard version every year. And, that changes over time. And then like version 1 just kind of went into, became a requirement at the beginning of 2023. So it's only been like really in place across all certified EHRs just in the past like, year or so. So it's, pretty new. But the data set evolves over time. And, as use of that type of standard increases, you have more people demanding certain data elements or of more data elements of interest to include in it, that the USCDI data element list will expand as well to like, kind of incorporate all of those sort of suggested elements. And so I think it's one of those things where it's like, you kind of start small, this is a situation where you go kitchen sink and it's like everything possible goes into this. You start small, you see what the interest is, you see where the use is. And I think with this study, you kind of get an idea of the fact that, a lot of this digital health connection to EHRs, still in its nascency to some extent. It gets, less than a decade old in some cases where people are, companies are actively interested in doing it. And so I think as more of these companies get interested in connecting to EHRs, see it as a value to them to connect and use those connections to move data back and forth. I think, the hope would be that the EHR vendors themselves, the standards development community, all those, all these folks sort of become more enmeshed and kind of talk to each other, and the industry itself kind of has not an awakening, but a better understanding of what are a lot of the critical data elements and new data elements that are needed to be supported. And so, I think, as a barrier, it's well, I hoped that these data elements would exist when I connected, but they weren't. And I think the hope is, as these things are tracked over time, that the industry, obviously the government, has a role in understanding what those needs are for the community, and there's a process to enable all that data to be accessible and right. Exchangeable.
Yeah, no, absolutely. I mean, it's we feel like in healthcare things move incredibly slowly, and sometimes it does, but in the scheme of this, where meaningful use and EHR adoption is only really 14 years old, 12 years old fully, and then that now it's sort of the layers that have happened, but also the change that has happened. So of course, as you said, Ben, that need for genomic data maybe wasn't being thought about then, and also that you have to, if you do it all at once, then you're going to have a lot of things that aren't of utility. So taking that time with it, so makes total sense. As we come to our end of our time, what were the things that, did surprise you, and where do you think there are opportunities for change? I mean, when I think about this and, sort of information blocking, you think about how this impacts the patient and care and the provider and obviously getting them all their information and so that there's an easy exchange of that information and a hope for that. Where did you, in the study, kind of what are the opportunities and what do we have to look forward to?
Now, one thing that I was a little bit surprised, but I felt really good about in the survey results is that there was a substantial demand or request from the digital health developers for more data elements related to social determinants of health. And you don't often see that, especially in the early days in startup companies. But the fact that sort of bubbled up to the top is one of their, one of the things that they would like greater types of data elements for, I thought was very telling and also very, very reassuring, maybe suggesting that these developers are thinking more about those social determinants, which are hugely important in health and also healthcare outcomes.
Yeah, I think the thing that I love saying that we kind of touched on a little bit. So we're talking about the fact that 73% of companies said that they were using standards-based APIs, and then there was about an equal number of companies that said that they had supported the FHIR standard as part of their product, and so not just using the FHIR standard as part of the integration process with the EHR, but the fact that the FHIR standard was something that they had used to develop their product. So finding that out. But I think the thing that was I think really important to see was if we have a figure in the paper that shows the number of EHRs that the respondents connect with. And so there was companies that connect with one EHR, companies that connect to 2 to 3 EHRs, companies that connect to 4 to 5, and so on. And what we see is a huge difference in these, the use of standards-based APIs and the use of FHIR amongst those different groups of companies. So those who said they only connected with one EHR, about 27%, I think, my memory serves me right, of those companies said that they use FHIR extensively as part of their product. And another half said they kind of use it. Whereas those digital health companies that said that they integrated with 2 to 3 or more EHRs, that extensive use was about 3/4. There's a huge difference between the use of the standard and the use of the APIs based off of the number of companies, EHRs that those companies were integrated with. And I think that ultimately is like the whole reason why the standardization exists. And so sort of like the value add of something like FHIR is that, you know, and like I said, I think at the beginning was like, if you are connecting to one company, one EHR, like all you probably really need to know is one mode of communication that's unique to that EHR. But if your interest is connecting to multiple EHRs, you want to connect to Epic, you want to connect to Oracle and Athena, you know, having and supporting this standard as part of your product is going to be essential, because like you don't want to develop your product parts of your, you know, application or service like many times when you're connecting. Like you want to support something that, you know, a standard that can be used to connect to each of those different EHRs. And that's the whole kind of logic and reasoning behind pushing for something like FHIR. And so seeing that unfold in the study, in the sense that like those companies that are connecting to multiple EHRs are supporting the standard and using standard-based APIs at the highest rates, I think is a clear, clear finding that like the reasoning behind supporting standards does work and does support the use case and reality. Yeah.
Right. For sure. Yeah, no, it is so important for these organizations to be able to, from a digital health company perspective, right? They all want to be technology agnostic to come in to be able to serve as many patients as possible, right? And the standards do make that possible. What's next? What is what does the next step of this look like? What does it mean for standards and kind of the future of ONC's efforts around information blocking and preventing it for the patient?
Yeah, so I mean, we obviously have interest continuing this line of inquiry. So we do plan future studies along these lines because it's like I think we had mentioned earlier. I mean, a lot of this technology was only required to be supported by EHRs just a few years ago. So at the end of 2022, beginning of 2023, EHRs are required to certify to these, new standard-based APIs. And so the study was conducted in 2022, really before a lot of those requirements went into force. And so it'll be good to kind of track this over time and to see how, the types of digital health companies that are working with EHRs, and also their, what are there sticky barriers? Are there barriers that are going down? I mean, for ONC, that's obviously a prime focus. We want to make sure that our policies are working, that we're focusing on the right policies. And so anytime we hear about a barrier that surprises us, then, it tells us like, there's something going on in the market that, in the industry that we're not aware of. And so, that's always like ONC's focus, is always making sure that its policies align with, what industry needs, but also broadly the community. So like, and you mentioned information blocking, like what is it that different exchange partners need? Patients for one, obviously patients are big advocates for, limiting information blocking and having access to their health information. ONC's, regulations, in particular the standards-based API, are meant to enable like greater access by patients to their data. So enabling more than like one method of access. You're not sort of restricted to just like a, portal access to your records. You have other methods of access that can be enabled through your EHR. But then, I think beyond just like, the information blocking related to patient access, you also just have the information blocking of just general health information exchange, because you also have provider to provider information blocking. You have technology developer and provider information blocking. I mean, it's the permutations of what information blocking could entail are not endless, but there's certainly many. And so, I think, APIs are seen, and, the FHIR standard is seen as a strong step forward in helping resolve a lot of interoperability challenges. And, I think keeping an eye on how those are, the APIs are implemented, and to ensure that there's not, a blocking of access to those APIs or a blocking of use of those APIs will obviously be really important to track over time as well.
Yeah. Ben, any closing thoughts?
Yeah, also, I mean, put a plug in for, so the standards-based APIs are kind of the how of the communication, but I'd also put in a plug for the what of the communication, which, as you've heard Wesley say, the US CDI. So, version 5 is now open for public comment, I think through, is it mid-April or so? And so the public can weigh in. And so I think that in the future, as we get the standards, as more and more vendors and digital health vendors, as well as EHR vendors, are adopting the how, the standards-based APIs, we will start to see then the what, so more data elements that become available through standards such as US CDI version 5. And so for those who are interested in trying to expand what's in each version of US CDI, I'd encourage you to check out the ONC site or make public those types of data.
Perfect. Yeah, no, we'll put some links up as well in terms of that, and as well as the studies, so that they can go to the source. Well, thank you so much for being here. Thank you for the research and the work that you did, because I think it's super important in terms of, really bringing some light to what people are using and what these digital health companies need, and how to, improve the connections. I think, Ben, you said, in terms of, machine to machine talking and communication, and making sure that that works seamlessly and, quickly to get patients and providers the information they need. So thank you both so much. And that is a close and a wrap for Digital Health Talks. Thank you.